One of the commonest topics, which is full of myths and misconceptions in IVF, is that of stress. And a lot of times, doctors blame the patient for the IVF failure, saying she was too stressed out, and that's why the embryo didn't implant. And what's even worse is it's not just doctors who blame patients for their being stressed out. Patients blame themselves, and if not patients, then patients' relatives. And the commonest pattern seems to be stress reduces IVF success rates, and patients who are stressed out are not going to get pregnant. And this is rubbish. No patient wants to actually come to an IVF clinic to get pregnant, and they all get pregnant all the time. So it's not the stress which reduces pregnancy rates. Please understand this. It's the IVF which causes the stress, and that's completely normal. These are infertile couples who are trapped in an abnormal situation because they're not having babies. They need medical assistance. It's no fun going to a clinic, getting scans done, getting blood tests done, full of uncertainties. Of course, everyone is stressed out. But stress is not going to affect the process of embryo implantation because this is a biological in utero process. Remember, even a woman who gets raped, her stress levels are going to be 1,000 times that of an IVF patient. But if she's going to get pregnant, she's going to get pregnant. It's a biological process. So please, let's learn to be kind to IVF patient, and let's stop blaming the victim, and let's stop blaming them that they were too stressed out and that's why the IVF cycle fails, because stress does not cause IVF failure.